we have to reroute blood flow for blocked coronary arteries, we have some choices of what to use. Most patients, maybe some doctors, might make an assumption that when we're doing open heart surgery for coronary blockages that we're literally going to be cleaning out the blockages in those arteries, but we actually don't do that. We actually leave the blockage alone almost all of the time, but you can almost say all of the time, and we actually tee in a new pipe into a clean part of the artery. That's part of why coronary bypass lasts longer than stents, because we're not working within a blocked portion. We actually find a nice clean spot of the artery beyond the main blockage, and we tee in a new pipe and we sew it on with a very fine needle and thread. The oldest bypass graft that we used historically were a vein from the leg. We have a spare part in our leg called the saphenous vein that runs from the groin all the way down to the ankle. We used to take that vein out using a long incision, which was pretty hard to tolerate for patients. Now we take that out using a video camera and an incision about that big, so that's great. But it turns out that we have things that last longer than that vein. So that vein is still, in the United States, the most common use. Probably 2/3 of all bypasses are done with that leg vein. However, more progressive places are paying attention to the data that's been produced that shows that the more arteries that you use for these bypasses, the better it is for the patients in terms of their long-term survival. An artery is kind of a muscular vessel that conducts blood to tissues. Vein is kind of a thinner-walled vascular structure that conducts blood away from tissues, kind of back towards the heart. So we have these a couple of other spare parts built into our body. We have mammary arteries that live behind the rib cage, and these arteries they're able to be sacrificed, for lack of a better term. You can literally dissect this artery out from the undersurface of the breastbone. It's really, they run along the ribs because they have a lot of branches that take over the job of that removed artery. And we actually kind of have to use this left, what's called mammary artery, during open heart surgery for coronary bypass as kind of a rule, because that is what is most associated with long-term survival after open heart surgery. So the typical operation in the United States would be a left mammary artery and 2 veins. That's probably what happens in almost 90+% of all coronary procedures in the United States. Those of us who are paying attention to the scientific data have known for a long time that if you add a second arterial bypass, so we have another artery on the other side of the rib of the breastbone that can also be used for coronary bypass procedures, that has been known for a long time to to enhance that long-term survival. And we also have a third artery to go after, which is a radial artery from the left arm. We have 2 arteries that run to the hand, and as long as you don't have any problem with the communication of those arteries, this is another artery that can be used. There was a really nice paper that came out in one of our most important scientific journals this year, whereas we knew that using a second artery from behind the rib cage was very useful. For the first time, a meta-analysis showed that using the radial artery was also associated with better survival, less heart attack, less re-intervention in the future. So in our program, we try to use more arterial bypasses than vein bypasses. And in a way, you would say the best possible coronary operation that you could get is a coronary bypass procedure where you've only used arteries. In the United States, that's very uncommon, and in fact, even the use of 2 arteries in the United States for a bypass procedure is only about 4% of all bypass procedures. And using 3 arteries is now becoming something that we can accomplish with more and more frequency. So this is something that we're trying to push in our community because we want our patients to live the longest after coronary bypass.